to talk about the pathophysiology of atopic dermatitis, associated findings, and management strategies. This includes barrier repair, reducing inflammation, and decreasing infectious triggers. We're also going to go over lookalikes that you should be able to differentiate from atopic dermatitis at the end of this lecture. So what is eczema? Eczema is just a general term which encompasses various inflamed skin conditions. It comes from the Greek for to boil over. One of the most common forms of eczema is atopic dermatitis. Dermatitis is not really a diagnosis. It just means inflammation of the skin. It becomes a diagnosis when you start off with another word. So atopic dermatitis, nummular dermatitis, irritant contact, allergic contact, or seborrheic. In my opinion, you can get rid of the word eczema entirely, although that is how most patients have heard of their disease. And so it may be helpful to keep that in your arsenal to relate to your patient. Atopic dermatitis is a chronic and relapsing dermatitis, which is characterized by intense pruritus. So some people call it the itch that rashes. There's a specific distribution based on age, which we'll go over. It occurs in 15 to 20% of the population, and the incidence is increasing for unclear reasons. There's no racial or ethnic predilection, but there is a higher incidence in more developed countries that has stimulated a lot of questions about whether this is due to excessive hygiene or the hygiene hypothesis. This can incur healthcare costs of up to $1 billion per year in the United States. So it really has significant morbidity and costs associated with it. The features include pruritus, eczematous changes, and this has a specific age distribution and age-specific pattern. Face, neck, and extensor involvement is noted in children and infants. Flexural involvement is more common in older children and adolescents, and the groin and axilla are spared. Adults usually have more hand and foot involvement. This can have a chronic or relapsing course, and there's often a personal or family history of atopy, including seasonal allergies or asthma. So first question is, what test can you order to determine if someone has atopic dermatitis? In this photo, we see two ill-defined pink plaques with overlying scale, and you can see that there's some excoriation and crusting. One of the features of atopic dermatitis are these classic pink scaly patches. It's particularly impressive on the face in children, and less commonly so in adults. You can get this follicular or papular atopic dermatitis with follicular prominence. This patient comes in with blisters on the palms and lateral aspects of the fingers. So what test do you order? This is dyshydrotic eczema. It looks like tapioca pearls, and there is no test for atopic dermatitis. So the moral of the story is there's no single blood test that you can do to diagnose atopic dermatitis. This is a clinical diagnosis.